If you're still working and you're turning 65 and you have group coverage, group health insurance, do you have to take Medicare? To answer that question, I'm going to break it into two groups. Those of you who are working with group coverage and it's a company with 20 or more employees, and those of you who are working at a company and it's 19 or less employees. Let's first talk about the people 20 or more employees. So group number one, you work at a company, there are 20 or more employees, and you have group coverage. In that scenario, you can stay on your group plan. You can delay Medicare. You won't have penalties for not taking it. You'll be able to sign up later during a special enrollment period. You have to provide the proper documentation at that time, whole nother discussion. And oftentimes people in that scenario, I tell them still to take Medicare Part A. You've earned a premium free if you have 40 work credits. But don't take A if you are contributing to an HSA, because then that tax benefit you get from the HSA, you lose. One more thing with those of you at a company with 20 or more employees, what I'm talking about right now are general rules. All you got to do is go to your HR and confirm that your plan is primary to Medicare. As long as it is, this rule does apply to you and you can delay Medicare. Now, for those of you that fall into group number two, you're at a company with 19 or less employees. Typically in that scenario, you do need to get Medicare. You're not going to have penalties for not taking it. You could stay on your group plan. The problem is that the way the laws, the rules are written, your plan, once you become eligible for Medicare, is no longer primary to Medicare, which means you would not have a primary payer on your claims. So why is that a big deal? If you got really sick and your plan realized that they were not primary, they could say, well, we do not have a responsibility here to pay your bills. Medicare has to first, and then we'll help cover the dollar gaps. But if there is no primary payer, they don't have that obligation. Now, for some of you in a plan like that, you could try to go to your company, see if they'll put it in writing that the insurance company will agree to remain as primary, but that is highly unlikely. And then one other caveat to this, for some of you, you may be in what's called a multi-group employer plan. So it's possible your smaller group could be primary. So you need to ask those questions to your HR. Once you've determined that it is not primary, that it is secondary to Medicare, you got to decide, do you keep that group plan as a secondary payer, which tends to often be very expensive, or do you get a supplement or a Medicare Advantage plan? So those are things that you get to think about once you realize you got to go on to Medicare. Now, I know this is plenty confusing and people reach out to me all the time. I help them figure out what they need to do. Even the people that fall into group number one, sometimes they call, we do a comparison to their group plan to Medicare, and we determine which is the best path. So just keep learning. I know it's confusing, but I'm here to help if you have some questions.